I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina. I have no financial conflicts of interest. I'd like to talk to you today about the placebo effect. And this talk will be in 3 parts. Part 1, what is the placebo effect? First, we have to start off with the definition of a placebo treatment. Placebo is Latin for I will please. A placebo treatment is any treatment which is inactive, which means that it has no effect on the disease or condition which is causing symptoms. And also you, as the patient, are unaware that this is a placebo or ineffective treatment. What is the placebo effect? The placebo effect is a beneficial result of treatment with a placebo. The placebo can be a drug or an eye drop, or any other treatment which is described as effective for your condition. To experience a placebo effect, you, as the patient, must have a belief in the effectiveness of the treatment. If you don't believe, you will probably not get a placebo effect. Belief is equal to benefit. A placebo treatment has no effect on the disease or condition causing symptoms. And notice that I have italicized symptoms, and I'll explain why in the next slide. And you do not know this. The placebo effect occurs when you have a belief in the treatment, and you therefore feel better as a result of this treatment. A placebo won't fix your broken leg. Placebo treatments work on symptoms which are modulated by the brain, things that you actually experience in your brain, not in your body. And the big one is pain, but nausea, anxiety, phobias, and other conditions will all respond to placebo treatments because they are essentially arising from activity in deeper structures in your brain. The placebo effect gives real pain relief. You, as the patient, believe in this treatment. You have an expectation of benefit. This expectation actually causes your brain to release endorphins or dopamine or even endogenous opiates. The release of these neurotransmitters down-regulates your pain processing center in your brain. So the placebo actually gives you real pain relief, but not because the placebo is directly treating the condition causing your symptom. Rather, it's treating your brain. Same idea, fewer words. You have an unhappy brain with an upregulated pain system. Placebo treatment X, which you believe in, leads to a downregulation of the pain processing center, making your brain happier. This is a highly recommended video about the placebo effect and the neuroscience behind the placebo effect. Go to brainfacts.org, use their search bar in the upper right, and just type in placebo effect, and this video comes up first. It's really great, and I urge you to pause now and watch this video before continuing with my video. You might be thinking, hey, Dr. B, I am resistant to the placebo effect. My reply is, well, maybe, but you don't really know. And as a matter of fact, many medications have both pharmacologic benefits and placebo benefits. And frankly, a placebo effect is great as long as the placebo is safe and not harming you in other ways, for example, financially. On a personal note, I would love to have a placebo treatment, which would let me wake up in the morning without being unduly stiff. I take nonsteroidals when I really need to, but they cause me to gain weight because my kidneys don't like them. So if I could have a placebo that would not cause me to get upset kidneys, water retention, and weight gain, and would also allow me to wake up without stiffness, I would be absolutely delighted. Just don't tell me that it's a placebo. Here's how your eye care provider can facilitate a placebo effect. Let's say there's treatment X. Your eye care provider recommends treatment X. He says, hey, I have a number of patients using treatment X and they are feeling much better. His belief in treatment X is contagious, and now you believe in treatment X as well. You like and trust your eye care provider. He is the professional who is helping you to manage your symptoms. You get a placebo effect from this belief, which gives you relief. This is a self-reinforcing situation because you believed in the drug or drop. You got a placebo effect relief, therefore increasing your belief. You feel improved. You're truly improved. You really are improved. You're better. If pain is your symptom, you have less pain. Your cognitive state of confident expectation of improvement has caused a real positive change in your brain chemistry, because brains are amazing. Is there any way to really ramp up or amp up the placebo effect? Let's consider treatment X. If treatment X appears similar to a treatment you have tried that has worked, it will have credibility in your mind. If it appears similar to a treatment you haven't tried but believe in, it will also have credibility. If this treatment is reported to work for patients like you, and this is where testimonials come in, this will increase your willingness to believe that treatment X will help you. Conversely, if treatment X is very different from previous treatments that haven't worked for you, this may open your mind to a positive anticipation that something really different might be much more effective. And this might come into play if you've had no luck treating your dry eye symptoms with big pharma products and you are being offered something which appears radically different, such as a regenerative medicine product. But something else that's really very important to know about placebo effect is that the more expensive the placebo, the more likely it is that you'll have a placebo effect. And this has been shown in multiple clinical studies. Cost more equals more faith equals works better because the placebo effect is stronger. Are there risks to placebo treatments? You might be thinking, well, the only risk is that I am actually resistant to the idea of placebo benefit, so it doesn't help me. But actually there are 3 specific types of risk. Risk number 1 is when a patient forgoes an effective treatment for a serious disease in favor of some other treatment, any treatment, which would be a placebo. In the news a few years ago was the idea that radical diet could cure pancreatic cancer. I have had one very memorable patient who believed that gazing at crystals would treat her glaucoma. And these were special crystals that she got from New Mexico. Now, I was all in favor of her gazing into these crystals if it made her more relaxed and more optimistic about managing her glaucoma, as long as she kept on taking her latanoprost. Where we ran into trouble was when she felt that the artificial chemical nature of the latanoprost was interfering with the beneficial effect of the crystals. Risk number 2 would be if the placebo treatment is potentially medically harmful, even if you benefit from it symptomatically. And we'll talk about how a supposedly inert or inactive treatment could possibly hurt you in an upcoming section of this talk. Risk number 3, as I've alluded to already, is that the placebo treatment harms you in a non-medical way. And the big one I'm thinking of here is financial strain. Placebo risk. Don't assume it's 0. Part 2 coming up. Why double-blind, placebo-controlled clinical trials are so important, and what those words really mean.